My guest today is an expert in women's health issues. I am so grateful to Dr. Montgomery for being with us here today. Good morning, doctor.
Good morning, Heather.
I want to start by talking a little bit about what it means to treat underserved women. In general, tell us what that means to you.
So there are many women in the United States, and clearly many women around the world, who don't have access to the level of health care which is available to those of us with good insurance and those of us who are at a university and have a good job. So, I believe the health care in the United States is the best in the world when you can get to it and when you have a good doctor and you have a good nurse and you have a good team that takes care of you. But many of the patients who live in the inner cities and many of the women who live actually in rural America just don't have access to the same kind of medicine. So here in Philadelphia, the safety net for women who either are not initially from the United States or from very poor areas of the city, they go to the city health centers, they go to the clinics that are established by the hospitals, and those are the women that we primarily serve, women who need the health care that we can provide and who have no other access but those special safety net clinics that we run.
And you do that here in Philadelphia, but you also have taken it upon yourself to do that internationally as well. Tell us about that.
Well, it's very important to me to equate life with life. And so as important it is for us to take good care of women in Philadelphia, that if you want to reduce the burden of maternal mortality in the globe, you need to go where most of the women in the world die. And those are poor areas, particularly in sub-Saharan Africa and parts of Asia. So we actually review in Philadelphia, and we're one of the only cities in the country that does this, every woman who dies as a result of being pregnant or within a year of pregnancy. It's a very sobering meeting, and it's very depressing. Different reasons for women around the world, and the reasons that women die, for instance, in sub-Saharan Africa, with our colleagues in Uganda, or colleagues in Gambia, are reasons that we've been able to overcome in Philadelphia. And so what we're hoping to do is to be able to educate our colleagues and give them the same skills and the same modalities so that we can reduce the burden of maternal mortality everywhere in the world.
Tell us about some of the ways that you're doing it.
So you can teach, traditionally in medicine, you teach with the patient who's in front of you. But to teach surgical skills, it's really important to be able to teach the young doctor and sometimes the young midwife the skills before they ever touch a patient. Much like we want our airline pilots to have landed a simulated plane 1,000 times before they fly me to Chicago, I would like to have every young doctor be competent on the skills of doing a safe cesarean section before they ever get a knife and operate on their first patient. Right. One of the things that we've developed with our colleagues at a small company in Maryland, a retired trauma surgeon, is a device which we have called Cecilia, for Cecilia, and it is the only high-fidelity C-section simulator that's in the world, so that we can actually train young doctors, some of them obstetricians, many of them not obstetricians, to do a safe, life-saving C-section before they ever get a knife and actually operate on a real person.
I think one of the things that people may not understand is that not all doctors are trained to do C-sections. It's just obstetricians. So you're really widening the net of people who are able to do that. Is that the sense of it?
So yes, absolutely. So in Philadelphia, on an occasional basis, more often than we would like, a woman comes to an emergency room and is already in extremis. The emergency medical services, people are doing, chest compressions and resuscitation. What we know is that if we can deliver the baby within 4 or 5 minutes of when the chest compressions start, that not only do we have a chance of saving the baby's life, but the chance that the mother will survive increases. In fact, just last month, that exact scenario happened here at Hahnemann, and our Drexel OBGYN doctor was able to deliver the baby, and the mother immediately got her heartbeat came back, and the mother's life was saved.
And right now, are you taking that simulator to Africa, and is that how you're using it?
So yes, we actually have taken Cecilia as part of a bigger course. It's not just the high fidelity end, but there's lots of process. As part of our ongoing program, I can't go to Africa and take care of women because I'm here in Philadelphia taking care of women. And what we need to do is to help our colleagues, particularly our faculty who are teaching the young doctors in Africa, to give them access to the educational resources that we have. In the past, it only was when one of us would go give a lecture. What we've been able to do with a grant that we've been working on with Rotary International is to create a real-time, high-speed video conferencing link between Drexel University in Philadelphia and Montgomery University in Kampala. So we can sit in a classroom here and a classroom in the video center that we've established in Kampala and present the same case to two groups of learners, the group of our young African learners and the group of Drexel learners.
Well, and one of the things I think that you can appreciate, and medicine has led me to appreciate a little more, is how small the world is. You know, we see with the Zika virus and Ebola that problems in other parts of the world impact us here in the United States. And I think you probably see that very, very strongly with these visits that you're making to Africa.
I think you're exactly right, and Zika virus is such a perfect example of how we are one world. It's such a small world, and it has to be important to us how women and children live their lives and how they have access to care, whether it's here in Philadelphia or whether it's another part of the world, because it's a small world and it affects us all.
Well, Dr. Montgomery, I can't tell you how much I, as a woman, appreciate what you're doing for women across the country and across the world, and I thank you so much for being here this morning and talking to us about what it is that you're doing to help women across the world.
Heather, thank you very much.